Welcome to Learning Plan 9, Crises Related to Sexual Assault and Rape. Obviously in this learning plan we're going to explore crisis issues associated with assault and rape, but we will also discuss rape trauma syndrome and how to intervene with a rape victim. The empowerment model with sexual assault survivors will also be examined. Let's look at the checklist of activities in Learning Plan 9. You will watch the introduction video, read Chapter 9, Sexual Assault and Rape, review the PowerPoint slides, and view two short clips. The first one may be difficult to watch. It's on a rape survivor on a college campus. The other one is also hard to watch. It's about an adult survivor of sexual abuse. The assessment activities include completing a quiz on Chapter 9, completing a discussion post and 2 responses, and it is also suggested that you complete your disaster response intervention paper during this learning plan, and we'll go over that in a moment. As always, continue compiling your crisis intervention paper and compile your facilitation of the crisis intervention. Let's further discuss your disaster response intervention paper. The directions are: natural disasters like fires, earthquakes, tornadoes, and floods, and community disasters such as gun violence and shootings can also wreak havoc on humans. Crisis intervention may be done at an individual level or community level when the trauma is a community disaster. For this PAT, I would like you to compare the interventions used in these situations, like critical incident stress debriefing and psychological first aid. Pick one and explain in full what it is about and why it helps. Now, I want you to look closely at the scoring guide. It says the criteria: number 1, response paper is at least 4 pages in length, uses APA formatting, and has at least 3 peer-reviewed articles. Number 2, your response paper is turned in on time and uses correct grammar. Number 3, response paper includes why you chose this technique. Number 4, response paper includes how this technique is different than the other techniques that may be used in these situations. And finally, number 5, the response paper addresses a specific technique and explains it in detail. Pay attention to these things as you write your paper, and as stated, it is suggested that you try to complete it at about this learning plan. Now let's briefly discuss Chapter 9. Rape and sexual assault are actually prevalent in society, and unfortunately in the military also. Generally speaking, the perpetrator is seeking to have control and power over the victim and humiliate her or him. Offering empowerment is the best approach for rape victims. The goal is to move the victim from role of victim to that of survivor. Support groups work well, as do cognitive behavioral approaches. This chapter discusses what is rape and discusses the rape trauma syndrome. It also discusses the empowerment model with sexual assault survivors. Pay particular attention to this, and discusses interventions with a rape victim. It also goes into and discusses date and acquaintance rape, which is actually quite common. Pay attention to page 204, box 9.1, things to keep in mind when helping survivors of date rape. It has some good tips. On page 206 to 207, box 9.2, includes cases to role play. Make sure you pay attention to the ABC model once again. They talk about emotional distress, substance misuse, validation, education, and they talk about how to use the empowerment and to reframe. Key terms for studying include date rape, empowerment model, military sexual trauma or MST, and rape trauma syndrome. I hope you learn a lot in Learning Plan 9.